And we're live. I am super excited and so happy to have someone really, really special to me today with us. How are you, Dr. Katz? How's your day going?
Great, Maritza. It's such a privilege to be with you because I've followed you for quite a few years now, and I think the things that you are doing with um, new practice owners is absolutely amazing.
Thank you so much. It's my privilege and honor to have you because you're a mentor and someone that I admire a lot. Today's topic is unlocking success for the remainder of the year with Dr. Stephen Katz. And as you guys are joining me, I just want to make sure the sound is okay and that you're able to see us okay. So let us know in the comments where you're watching from. And if you have any specific questions for him, post them in the chat and I will make sure that I ask them. But the reason why I decided to invite him, and thank you again, Dr. Katz, for taking the time to joining us today, is that for every business owner, as we are embarking on this journey of starting our businesses and growing our practices, we reach a certain level in our business life cycle where we feel stuck. And now we're already in the month of September, and we all take the year off in January with so many goals and so many aspirations and so many things. And we get bogged down by like this cycle of things that are always keeping us from growing. And so I wanted to ask you a couple of questions, and I have a ton of questions. But before I get to those questions, I want to make a proper introduction and let the people that are joining us live or that will be watching the replay why they should stick to the end. And we have a special invitation to make towards the end of our live today, so that you can really take advantage of the knowledge that this man brings to the dental industry. So, Dr. Stephen Katz is a practice growth coach and the founder of Smile Potential Dental Practice Coaching. Dr. Katz began his career as an oral maxillofacial surgeon and then transitioned back to restorative practice, right? For
Yes.
over 30 years, he has owned an award winning complex restorative practice in Malvern, Long Island, my neighbor. And he has been an attending at North Shore University Hospital. And get this, the team dentist for the New York Jets and an on air dental consultant at Fox News. In 2014, right? In
Yes.
2014, he wrote and published a book that is very dear to my heart that I have myself, and I highly recommend that anyone watching who wants to grow their practice also grabs a copy of this book. They didn't teach us that in dental school, right?
Yeah.
And then in his, basically, also, he was named one of the best news speakers in the dental industry. During the last 8 years, Dr. Katz, watch this, has coached, and his coaching team have helped over 100 practices in the New York metro area and helped them achieve over 150 $50 million in revenue. Okay.
Growth.
So
Growth.
growth. So his focus, and this is where this is so important to me, and I wanted to bring you and ask you questions because your focus, listen to this, is not on selling production, which is what everyone's main focus is, but it's on really raising the standard of care, raising patient perception of the value of the care, and teaching dental professionals the verbal skills to create that value. Okay. Dr. Katz believes that when you accomplish these three things, the production goes up by itself organically. So again, I get everything, and I'm like so super excited to be able to ask you questions.
That
And
was wonderful. I appreciate your introduction. And I'll just add one thing to it, and that is that any of the doctors who are working with you who would like a copy of my book, it would be my privilege to make it a gift.
beautiful. You see, guys, this is really exciting. Okay. So, anyone that wants a copy of the book, make sure you leave your name on the comments, and I will pass down the information to Dr. Katz so that his team can get a copy of the book to you. So, the topic for today, and the reason why I invited you, as I said earlier, is that we are almost over, like reaching the end of the year. And businesses, we feel like, oh my gosh, I had so many aspirations, so many goals, and so many things, and I feel like I am not reaching those goals. September is sometimes called September, and everyone feels like I need to do something before the end of the year to turn things around. And so I have just a few questions for you. And my first question to you is, um, giving your experience and having run your own practice for so many years, but also coach so many practices and be able to achieve these results for them, what do you feel is the greatest determinant of success for a new practice owner?
I'm going to tell that with a story. When I purchased my practice in Malvern in 1984, that's dating me, I guess. It was a wonderful gentleman, Dr. Alfred Sternfeld, and he was going to remain with me for 2 years. And we had a policy, an understanding.
Did I lose him for a second? I think I lost him. Let me see. Ah, I are you guys able to see him or did I miss him? This is live, so all these technical things are part of the show. Let me know in the comments. Let me go in here. I think he froze, and this is such a good part. Awesome. Oh, he had to leave. I'm sure he'll be rejoining us shortly. Okay. So I'm just waiting for him to rejoin us. We are having some difficulties here. Dr. Katz should be with us. Yes, he did lose his signal. So thank you for being patient and sticking around. We'll give him a few minutes to rejoin us and let us know if you're finding this conversation interesting. We have a lot to learn from him, so stick around. Let me give him a call and see. He's back.
All right. We
You
had
are
a
fine.
we had a momentary power.
I see that, but everyone is excited and patiently waiting. So we're glad that
I
you're back.
apologize. So what I was saying was that we had an agreement that every day that we were together, we would have to spend a half hour sitting in the private office together, sitting across the table for 15 minutes with my background in surgery and advanced restorative dentistry. I would have to explain something to Dr. Sternfeld about clinical dentistry, whether it was a new technique, whether it was a it was a procedure, it was a new instrument, some technology. I would have to explain something to him that I could help build him up. And then for the other 15 minutes, he would have to tell me something about how he built his very successful practice, what I would do for patient management, for team management, things of that. So the determinant that I think comes from that is realizing the benefits of experience.
Okay.
For a beginning practice owner to understand, to realize the benefits of knowing what you don't know. And as a beginning practitioner, there are a lot of things that come into play. And to understand that it is really, while the clinical skills are so important, the communication skills and ability to create relationships is really what's going to determine how successful the owner of a practice is.
I love how you mentioned relationships. Just one thing that I want to add that really struck me. I have been to your office years ago because we've known
Mhm.
each other. I consider you a
Yes.
friend and a mentor. And one of the things that really caught my attention when I came to your office was that you have these books where it was like they spoke to me. Like you had self-development books and other amazing things in the waiting room that just spoke. This is a very personable place where I feel comfortable and where there is something for everyone, and you're invested in in building relationships with your patients. So I love that. So
20
basically,
27 years ago, I had a very critical health scare where I was mistakenly diagnosed with cancer. Thank God it was a mistake. But I was told on a Friday and told that I would be admitted to the hospital the following Tuesday for the tests. And during that experience, that weekend was hell for me, thinking that it was the end. I bought videotapes so I could record messages to my 3 daughters when I wouldn't be
oh no.
around. And then, thank God, it was an error.
Okay.
And what I did at that point was I purchased 1,200 copies of a book called "Don't Sweat the Small Stuff" by Carlson. And I sent a copy of that book to every one of my patients.
Wow.
And to this day, if I see one of my patients in the street, in the shopping mall, anywhere, they still talk about that as being something not that their dentist would have done, but what one of their best friends would have done. And that was the type of environment that we tried to create. When I was in between patients, I wouldn't sit in my private office. I would sit in the reception room with a laptop because I wanted to be able to greet people and give them a hug and welcome them into my happy dental home. And it was creating that type of an ambiance, which is what helped earn my practice, best dental practice on Long Island, for the last 3 years that I had it. It did, while I strived for perfection in my treatment, and I was a master in the AGD, and I had the background as a surgeon, and I did a lot of, really advanced treatment. It was really the relationships, it was how we made the patients feel that drove the perception of success for the patients.
Wow, this is amazing. And I hope you guys are really paying close attention because I think that we are in the business of building relationships.
Mhm.
And to your point, I think that was the book that I read. And if I remember that, imagine your patients. It is something that you don't often see. Like I have been to dental practices where the dentist will only come, like they're sitting behind the front desk of a patient walks in, and because the patient is not on their chair, they don't greet the patient. They speak to the receptionist or their administrative team, and they go. And only when the patient has gone through all of the logistics and the workflows and the systems and processes, they then feel that it's time for them to start building a relationship. So that's really critical, and I thank you for sharing that. So one of the key determinants or greatest determinant for the success of you as a new practice owner, if I just to recap, when you started with your business, you were developing, understanding the benefits of experience. And I guess picking up from in your situation based on your story, you had you were working with a partner, and you took the time to mutually communicate your clinical skills and teach and mentor one another, right?
Yes. And with creation of clarity. And it's not just for the doctor. It's creation of clarity on what your goal is in the practice with your team. The
Hmm.
more time you invest in team in the early
Hmm.
part of your relationship with them, the less time you have to spend on the back end trying to
Hmm.
correct them and change things that they're doing. So really indoctrinating your team into your
Hmm.
philosophy, your vision, how you want them, emphasizing how important they are.
Beautiful. I love that. And that's absolutely crucial. So, my next question for you is, because I know your time is very limited, but I
Mhm.
also know that you have been very generous and offered to spend more time with us. We have a webinar coming up, so I want to be able
Yes.
to just be respectful of your time now. What another question that I have for you that comes to mind is, what would you consider to be one of the surest ways of growing a dental practice?
So, especially in the management coaching, management consulting field, we talk about, everybody talks about, if you just got me more new patients, everything will be fine. And the talk is that, the key to the success and growing practice is getting new patients and fee-for-service patients into a practice. Getting new patients is important, but it takes time. It takes expense with marketing. Doing increasing number of high revenue procedures that you do is also a really strong way. It's increasing your capacity, adding more rooms, adding more hours, adding more days, things like that. But the absolute surest way to grow a practice is already inside your practice, inside the records of the patients who are already there. And it takes two things. Number one, calibrating your diagnostic criteria so that you are practicing in a way that is not conservative or aggressive, but protective of the patients not having subsequent disappointments,
I
and
see.
having patients who ultimately become disappointed in the doctor because of some disappointment. And then once you have calibrated your diagnostic criteria, and we study this using analytics, we know that the average practice will diagnose something to be done on 34% of the patients coming through hygiene. So if a doctor has a diagnosis percentage of 20%, if they truly are very conservative in their diagnosis, that's one thing. But usually it's because of other factors. It's because of approval addiction, worrying about if they overwhelm a patient that they're not going to accept. So the other part of that equation of the things that will surely grow a practice are calibrating your diagnostic criteria and then mastering treatment acceptance skills.
Okay.
And when you do those two things, the success of a practice is absolutely guaranteed.
So calibrating your diagnostic criteria and mastering your case acceptance, basically, if you will.
Yes. And that's the advantage in our coaching system, because I had coaching during my career. When it was someone from outside of the dental community, I didn't think they connected with my dentistry. If it was a former office manager, I wasn't sure whether they really connected with my clinical team. If it was a former hygienist, they didn't connect with my administrative team. So that our coaching system is one in which, when we work with a practice, we come in with a doctor, myself. We come in with an administrator, either Kelly, my partner, or Donna, who had every role in an office, whether assisting hygiene and administrative at one time, one of our hygiene coaches, or an assistant coach, so that every member of the team has their own coach, and nobody can ever say the coach is not an expert at doing what they do. And
That's just
the
amazing.
advantage in having, there are very, very few and far between doctors who do management coaching. What an advantage that is for a younger doctor in helping them advance their management skills as a doctor. I talk their language. I know what schooling they've been through. I've been through the same thing, and I've gone far beyond, because, having been a specialist for a short while and then working towards a mastership in the AGD and being a fellow in other organizations and in implantology, et cetera, I've walked their walk and I've talked their talk, and it really positions us to really help them grow their practice quicker.
It's amazing. One thing that I want to touch on that really caught my attention as you were speaking, was when you were talking about calibrating their diagnostic criteria. You said something, and correct me if I'm wrong, a lot of times the dentists think that they're going to overwhelm the patient, or they have elaborate a little bit more on what are some of those things that you notice in your clients as you're going into their practices and you're reviewing the number of, unaccepted treatment plans that are out there. What are some of those concerns or limitations that these dental practitioners struggle with as they are trying to that leads in your observation or experience to having an issue with their diagnostic approach, diagnosing the treatment that they should be doing?
So I was just in a practice this morning with a young doctor who, trained his hygienist to be diagnosing perio as he should. He is spending a lot of money on advertising and he's getting a good patient flow. But when we looked at some of the analytics, we saw that they are overwhelming their patient with pre-engineered perio programs, soft tissue management programs,
Mm,
and doing all sorts of things. And I saw a couple of patients coming through that practice when I did my observation, where the patients coming in were getting fees of $600, $800, $1,000 on their initial visit.
I
And
see.
ultimately, their new patient values were $600.
Mm,
$600 is not more than the initial diagnostics, maybe a debridement, maybe a quadrant. But these patients were getting scared off and not returning for the restorative dentistry.
that
And,
makes sense.
when young doctors start to speak to patients about their treatment, patients are fickle. If you tell them that they need too much, they may not like you. If they don't like you, they may go elsewhere. So doctors feel like they're walking on eggshells and are afraid to speak to the patients about what they. The key is developing verbal skills that enable you to not tell patients they need treatment, but to talk about the benefits of the treatment so that ultimately the patient wants the treatment. And when
That's
patients want treatment, they are willing to forego other things in order to pay for it. They will prioritize the expenditure, the investment in their health with good verbal skills. And it's one of the most important things that we teach every practice that we're dealing with in helping them grow.
We have a commenter here, Dr. Daniel, who said it's about building rapport with patients. Most dentists don't connect with patients on the human level. They're afraid to learn, to lean into the strength of their own personalities. Thank you for your comment. This is great.
Yeah,
Um,
Dr. Faber, that's masterful. And it's one of the reasons why I feel that when patients come into a practice, the first appointment should be with the doctor because that's where the relationship has to be forged. And in medicine in general, where can you go in these days where the doctor spends valuable time? So to have the dedicated time of myself with a patient really forged a relationship of trust. There's a cycle of trust that all patients have to go through, before which time they will accept comprehensive and extensive treatment.
and
The
I
better
think
the relationship, the sooner in that relationship they will be willing to accept that dentistry from you.
I love it. And we're going to be diving deeper into this specific strategies on our webinar.
Mhm.
So I'm excited for that. My next question for you is, since I want to be respectful of your time, how important is the development of the team? I know that you focus on the doctor. The doctor has this vision. We are crafting our diagnostics and really building that relationship with the patients, but what role does the team play in growing a dental practice?
So I learned early on that I would only be as successful as my team could help me become. And so I always like to say that I worked for an incredible group of women.
Mm.
They told me what to do, they told me where to go, and if I didn't listen to them, they told me where I could go. And the team is what drives the success. Understand that in your practice the most important person is not the doctor and it's not the patients. It's the team. Because if your team is treated like gold, your patients will be treated like gold by them, and you will have a much easier time in getting the patients to understand that the team approach is what's going to get them to the end result of health, of having a beautiful smile, of being able to chew. It makes it a lot easier to speak about the benefits if it looks like there's a lot of synergy between the members of the team.
So if I'm understanding correctly, similar to when you started speaking about the huddle that you used to have with your partner when you started out in 1983, and you used to have this, conversations about how to develop, their skills, or in exchange ideas and strategies for mutual benefits of the patients, right? And to learn. What I'm understanding, correct me if I'm wrong, is that you also take into consideration to make sure that what you're saying to the patients, and as you're explaining treatment, and as you are building these relationships, there's synergy, and your team is also a sort of like an extension of you, so that it supports the perceived value of the practice. And we're going to dive deeper into how to do that on our Zoom webinar coming up on September 20th. But give us a little bit of, am I on the right track? I just want to
Absolutely.
understand for the rest of the people
You know,
out there watching.
I talked about relation with patients, but ultimately it was the relationship with my team that when people came in, they knew that they were in the presence of a team that thought the same, had the same goals, was willing to do anything to make them as overwhelmed with satisfaction of the type of care. And that doesn't come in, that takes work. That's
Yeah.
the culture of a practice. It happens either by accident or on purpose, but it was very purposeful for us. I had a clinical psychologist run team meetings 4 times a year. And I wanted it to be where it was almost like family therapy, where we made sure that we were communicating with each other in a positive, reinforcing way. I wanted to make sure that I was always showing tremendous appreciation for my team, because appreciation goes a long way. And most of the teams, crave for doctors who will show constant appreciation. That's the most important currency with team. When we've polled employers, they think it's pay. If you poll the employees in practices, the thing that they want most is appreciation, as long as they're paid, a fair amount.
This is awesome. I love that. So it is important for the team development in growing the practice, and you just share some really interesting, strategies. Appreciation being the most important piece of it, and building relationships with them. I love how you said that you had a clinical psychologist come in. How did that is such an amazing approach to have with your team. I've never heard that before, so
Well,
that's great.
see, I married a therapist because I needed to. And she has impressed me with, and the expertise in psychology is really the expertness in communication skills,
Yes.
how we meet each other's needs, how we make each other feel good. And that has been a strong force for me. And I love bringing that to our practices. One of the things that is in teaching teams how to communicate in any team situation, there's going to be disagreements. How do
Yeah.
you deal with conflict? How do you resolve that conflict in a way where everybody comes out of it thinking that they're better off than they were before?
Definitely amazing. And I think that my last question, and I want to ask you to leave us with something that they can implement immediately in their practices. But before I get to that, my last question for you for today is, what would you consider a surprising differentiator for a successful dentist? What sets
Cl-
them apart, right? Like,
Clinical expertise is essential. You
okay.
have to strive to be the best clinician you can possibly be. But the development of leadership
Mhm.
for the doctor and the members of the team is really the differentiator. And this makes up a big part of what I do in working with especially young doctors, in helping them to develop the leadership skills that meet what I like to call the leader's challenge. Creating a vision for the team, inspiring that team to buy into that vision,
Mhm.
and you want the team to be motivated in their own right to want the doctor to be successful. You cannot motivate a team. Motivation is an internal phenomenon. So you have to make them want to be motivated. And though that takes a lot of leadership skill to be able to communicate to them in a way that reinforces their great behavior,
Yeah.
correct things that they do wrong in a way that doesn't it's not speaking down to them, constantly building them up. And in the end, when you can accomplish that, you have everybody working in the same direction, pedaling that bike in the same way, you know,
I love that. I love
pedaling
that
that boat
analogy.
in the same direction. It's a lot easier to go with, my wife never learned how to ride a bicycle when she was younger. And I spent 30 years trying to teach her, numerous falls and scraped knees. And ultimately, I broke down and I bought us a tandem bike.
What's a tandem bike? English is my second language.
It's a bicycle built for two.
Oh, okay. I just learned a
And
new word. What
and
is
the
the
thing
what's the
is,
word again?
it's a tandem bike.
Tandem bike.
And that bike goes a lot faster when she's pedaling as hard as I am.
Oh, I get it. I get the analogy now. So now it takes like the speed goes by, by having the two people at the same rate, just running the
Everybody pushing ahead. What I want is not a doctor to be pushing a team, but for the team to be pulling the doctor.
I see. I love that. And I can from my and I share your philosophy, and I come from the other side as an employee, right? Like I started my career as a clinical dental assistant,
Mhm.
level entry position, just scrubbing instruments in a small dental practice. And I had this sort of hunger to just learn and continue to develop myself. And my former employer helped me fulfill that by just continuing to expose me to different things. And when there was an opportunity for an expansion, I helped them, expand and open multiple offices. I It was a vehicle for my own personal growth, and through that, we all of us accomplish great, collaborative, collective growth. So I'm a strong believer, like as
And
I'm starting my
you in particular have taken it to the next level with all that you've accomplished in the practices that you worked in, and now the practices that you're helping get started and getting them on the road to growth.
100%, because I feel that I can relate to everyone in the office, from the clinical back team and now as a business owner myself, having to go through the same struggles of setting goals and hiring and working with people and developing my team. It's a lot of work, but it's very rewarding. And one of the things that I always believed in is surrounding ourselves with people that are going to lift us up, that are going to mentor us. And I really love how you said that from the beginning in 1984, when you started your practice, you seeked for advice and to learn from others and to give and be open to receiving. And you've had this philosophy for all of these years, and you've been able to pass that down and create so much success for so many of your clients and your people. And I am learning as I remember when I first met you in person, you were at a speaking event for TD Bank, and you caught my attention because I was like with my little notepad. I still have those notes and taking notes, because I just, like, you have to be always looking and willing to learn. So
And that's
I
where our
think
collaboration is so good, because you've done such a great job in helping doctors create a foundation. And what I look forward to is perhaps helping some of your doctors take that foundation and now build a skyscraper on it, and really go to the unlimited potential in their success.
I'm ready to just basically I'm sort of like their doula. I get them to get their
Okay.
babies up and running and in good health, and
Mhm.
and troubleshoot all of their early stage mistakes, and get them into the right path of success. But the clinical skills and the contributions that you can bring on are really going to be able to set them up for even more success
Mhm.
once they have that foundation. So any last what is one thing, because again, one of the main reasons why I wanted you to have this conversation as we're getting close to the end of the year, what's one tip or advice that you would give a dentist to go ahead and implement immediately tomorrow in their practices?
Developing a strategy to work on your practice, not just in your practice. To not become complacent with how
Mhm.
things are, but look for the opportunities to take it to the next level.
Beautiful. And speaking of the next level, we have a webinar coming up September 20th, I believe, 7 p.m. Eastern time,
Mhm.
called Taking Your Practice to the Next Level. So for those of you who are interested in joining us for this free webinar event and continue to learn more so that you can have the foundation and a plan for the
Mm,
remainder of the year and beyond, make sure to join us. I'm going to make sure that my team enters the registration link there. So we're going to open up the registration
great.
later on today. If anybody has any questions or comments for me or for Dr. Katz, don't hesitate to reach out. I have one of our attendees has one last tip, and I want to share it with everyone. Don't mention anything about dentistry until you connect with the patient as a person.
Mhm.
If a dentist can connect first like this, then there will never be trust. Once there's trust, no selling is required ever. I love it. Thank you so
Dr.
much, Dr.
Saber,
Saber.
you speak my language.
Yes, thank you so much for joining us today. And for everyone watching, thank you for being a part of my network and supporting me. And I look forward to seeing you, Dr. Katz, on the
Yes.
20th. Thank you so much for your time. I really enjoyed our conversation
This was
today.
wonderful. Thank you, Maritza.
Take care, everyone.
Bye.
Bye.